here to share a few facts about pediatric coughing and the use of inhalers in that. Now, most frequently we find that when the children come to us with a complaint of coughing, whenever we put the stethoscope on their chest, we can find a breathing trouble, which is to be corrected with inhalers only, not cough syrups. There are a few notions about inhalers which are not right, like inhaler is habit making, inhaler causes dependence, inhaler causes side effects, inhaler is not good for children, blah blah blah. These are all wrong. The right thing is the use of inhalers is always beneficial. It is devoid of any side effect. It never causes any dependence, and as the drug is carried into the windpipe and is exhaled out, so there is no absorption of the drug into the bloodstream, so the question of side effect doesn't occur. This has to be kept in mind. So please go ahead with the inhalers whenever there is a suggestion from the doctor. If he or she tells you to use inhalers for pediatric coughing, then just don't delay or don't hesitate. Thank you.